you for joining us today and for your continued support in providing information on the COVID-19 pandemic to the public. We couldn't do this without the assistance of you, our media partners. We have prepared statements from each of our speakers. During this time, we ask that you type your questions into the chat function on the platform. We will read and answer your questions at the end of the prepared statements. Now I present Mr. Ed Rivers. He is the administrator of the Scott County Health Department. Go ahead, Ed.
So we're operating with the understanding that COVID-19 is in the community. We've been stressing that in prior press availability. But as we hear more about positive cases in Iowa, we're learning that positive COVID-19 cases are being reported according to the county of residence of the patient and not the county where the patient tested. A local healthcare provider reported receiving information of a positive case that was tested in one of their Iowa clinic locations. This individual is not a resident of Scott or Rock Island County. Therefore, the Iowa Department of Public Health will not be reporting this as a Scott County case. Individual information is not being shared. Again, because we believe COVID-19 is in the community, we expect that we'll continue to see positive cases. We must work as a community to minimize the spread of this disease. So we implore you to please continue to wash your hands with soap and hot water or use hand sanitizer. If you experience symptoms of fever, cough, shortness of breath, call your healthcare provider or a walk-in clinic before you go to seek care. And if you have these symptoms, stay home. We'd like to address what is likely people having trouble coping and anxiety about COVID-19. The spread of COVID-19 in our communities is an unprecedented event, and it often feels that there are more questions than answers. We recognize these uncertain times are stressful and can cause anxiety. So we encourage all of us to stay calm and listen to the facts to help reduce your fears. Keep up to date on important information when needed by using trusted sources such as the Centers for Disease Control and the Iowa and Illinois State Departments of Health. Focus on what you can do to be prepared, including be informed and taking efforts to control what you can, like washing your hands and other prevention strategies. When you feel you need additional assistance in managing your stress and anxiety, please reach out for help. We are sharing state and local resources in the press release following this press briefing.
Hi, this is Nita Ludwig, Administrator for the Rock Island County Health Department. As we shared yesterday, the proclamations in each county addresses restaurants, bars, public venues, and social gatherings. We recognize that this does not include businesses and workplaces, where we know many of our residents spend considerable time. There are steps individuals can take to help prevent the spread in their workplace if it is still open for business. Stay home when you're sick. If you have symptoms of serious respiratory illness, you are recommended to stay home and not come to work until you are free of fever, and that is defined as 100.4 Fahrenheit, free of signs of fever, free of any other symptoms for at least 24 hours without the use of fever-reducing or other symptom-altering medications, for example, cough suppressants. And also notify your supervisor and stay home if you are sick. If you're at work, determine how you can maintain social distancing. And that means maintaining a 6-foot distance between you and other individuals. Look at your desk or workplace setup. Ensure that employees aren't directly facing one another if you can. Continue to follow hygiene recommendations while in the workplace. Again, wash your hands with soap and hot water or use hand sanitizer in between if you can. Cover your cough with your elbow or disposable Kleenex. You can work with your employer to post posters from the CDC in areas around your workplace to help reinforce these messages. Help keep your workplace clean. Ensure there is regular cleaning of frequently touched surfaces, such as workstations, countertops, and doorknobs. Make sure to follow the directions on the label. Watch for any additional messages that come from local or state public health or the governor in upcoming days. The changes in recent days have limited the contact individuals have in places such as schools and restaurants, bars, public venues, and social gatherings. However, we want to encourage those over the age of 65 and those who have underlying medical conditions to consider how they can best protect themselves if they need to go out in public for various reasons. To better describe underlying medical conditions that may increase serious COVID-19 risk for individuals of any age, the underlying conditions consist of blood disorders like sickle cell disease, or if someone is on blood thinners, chronic kidney disease as defined by your doctor, chronic liver disease as defined by your doctor, compromised immune systems, also called immunosuppression, current or recent pregnancy in the last 2 weeks, endocrine disorders such as diabetes, metabolic disorders, heart disease such as congenital heart disease, congestive heart failure, and coronary artery disease, lung disease, including asthma or COPD, among others, and neurological and neurologic and neural development conditions. Have these conversations with your doctor on how to best protect yourself from exposure.
Okay, thank you. That is the prepared conversation or information that we have at this point. We will now go to questions, so please bear with us as we go through the lists that are here. The first question, and this relates, I believe, to what Ed has provided us today. Can you clarify that again? Did the person not live here but visited here?
The person was tested in Scott County, but is a resident of another county in Iowa. That case was reported out in the Iowa Department of Public Health's information yesterday.
A follow-up question to that, was this person that tested positive working here, visiting, or just passing through?
That's all the information we have and can release.
Okay, we do have another question. Nita, if you want to start on this first. To get tested in the QCA, do you still need to have contact with someone who traveled or lived overseas? Or is it open to anyone exhibiting symptoms?
Okay, I will just say there was a webinar earlier today from the Illinois Department of Public Health, and we do believe the criteria is changing, and I don't believe we've received it yet. But just note, this is a rapidly changing situation, and it is likely to change in the next hours or even tomorrow morning. But at this time, travel or contact with somebody who has traveled or lived overseas is not the only criteria that could warrant a COVID test. That is one of the criteria, but it is not the sole criteria.
Okay, Ed, we will ask you the same. To get the test in the QCA, do you still have to have contact with someone who traveled or lived overseas, or has that changed?
Your medical provider will perform a triage and determine whether you need to be tested.
Okay. Are mental health issues on the increase in both counties as this problem continues?
We haven't had a report of it, but we will check with our community services department to see if they are having more contacts.
Do you have anything to add to that, Nita?
Yeah, I would say there's really no way for us to know that at this time. However, we do anticipate, because of the seriousness of COVID-19, that people would have anxiety, and that is why we addressed it today.
Okay, in Scott County, can you say how many tests are pending? Ed, can you speak to that?
Well, as we've repeatedly noted, in Iowa, we do not have information on how many people are being tested. We will only know if positive tests are reported to us.
Nita, perhaps you can answer this one as well. What do you recommend people who are having difficulties with stress currently do to COVID-19 take? What steps should they take?
Sure. So I would definitely recommend reaching out to your primary care healthcare provider. They could possibly refer you to other providers or agencies in the area who could help in this kind of circumstance.
Thank you. Nita, this is for you as well. How many tests have been administered in Rock Island County as of today, and what are the results?
Sure, I can give you some of the numbers from this morning. And here at the health department, we have authorized 36 tests as of this morning. We still have the 13 negative results, which means that the others are still pending. We are getting test results in kind of on a staggered basis as they get done with them at the laboratories. However, again, I would like to stress that while testing is important, I really would like to see people focus on the slowing of the spread of the disease, the social distancing measures, and the clean, cover, and contain. When we do have positive results, we will share those.
Next question, are you receiving an increased number of phone calls? Ed, what has our department seen?
We're constantly on the phone.
Anita, how about your office?
Yes, we are fielding calls in all our departments, our main phones, our infectious disease staff, our environmental health staff, and all the management staff as well. So yeah, we're seeing a lot of calls.
Ed, this went to the comment that you had, but it's regarding the case they were asking about. How old is the patient?
We've already conveyed the information we're authorized to release.
Next question, are there any health departments aware of any doctor-directed tests or quarantines of medical professionals at Unity Point or Genesis?
No.
No.
Nita, do you have any? Okay, thank you.
No.
Sorry, we have some additional questions coming in. Is the new positive case an instance of community spread?
We don't know.
That question would have to be directed to the Iowa Department of Public Health.
Since the governors in both states closed restaurants, bars, and other businesses, have there been any violations that you were aware of? Nita, do you want to start with that one since that's been, I think, an additional day or so for your side of the river?
Sure. I know that we had a couple questions on that, and I have spoken with our environmental health staff, and they have been out in the community, and they have said all the businesses that they have been by and through have been in compliance with the proclamation.
Ed, how about on the Iowa side of the river?
What was the question? I'm sorry.
Restaurants and bars, have there been any violations that you're aware of?
Well, it was a quick turnaround in Iowa. The order came out at about 10:30 and was effective at noon. I understand that the Bettendorf police may have spoken with some bar owners last night and explained that they were not allowed to have patrons inside, but the great majority of facilities are complying.
That leads into the next question. I think that gives some answer to that. Is the Department of Health investigating any restaurants or bars that have remained open?
None to my knowledge.
Nita, do you have any on your side?
No, we don't believe we have any in our county.
Next question. So the patient who tested positive in Scott County's a case in Iowa that was counted on Tuesday, just want to make sure I understand.
Our information is that the case that tested positive, which was performed in Scott County, was released in the Iowa Department of Public Health's information yesterday. That's what we're authorized to inform you.
Okay, just making sure there's no additional questions. We'll give it another minute, and then if we don't see any additional, we'll wrap up. So I'll give it 1 minute here. Additional question. Are you continuing to examine hospital preparedness?
We're working close with all our community partners. We're receiving reports from the hospital about their daily operations. They continue to work on their preparedness plans.
Nita, do you have anything to add to that?
Yeah, I would just echo that. We've been in communication with the hospitals multiple times throughout the day, every day.
Okay, one additional question. Can you share again what is the status of the patient? Is the patient hospitalized or in isolation at home?
They are not our patients.
I've conveyed the information that we're authorized to convey at this point.
Is there any concern about supply shortages, protective equipment, ventilators, masks?
We received an email from the Iowa Department of Public Health today requesting that those organizations that might have stockpiles of PPE consider donating them. So they're trying to make sure that there's a sufficient supply of PPE for medical providers who need them.
Nita, anything on your side of the river?
Yeah, I would say I know that the Illinois Department of Public Health is working hard to make sure that our healthcare facilities have the supplies they need. There is concern, I think, even nationwide, about supplies being low, especially masks. But we are working through the state with those issues and our emergency management agencies.
Are you all well? Any anecdotes that you have to share? Ed?
We're very proud of our staff here because they continue to work hard. They are proud of being public health employees and working to slow the spread of this disease. And since there are no reported cases in Scott County, we're all well.
Nita, how about your staff?
Yes, we are all well as well, and we're grateful for that. And we have all of our employees are great ambassadors out in the community to share the messages about washing your hands and covering your coughs, and so we're very grateful for our dedicated staff as well.
Mm-hmm.
Who are the organizations who would have stockpiled PPE?
Well, I didn't mean to characterize it that way. It was just a request that as an example, the many dental offices are closing, and they may have PPE that they can donate. Since they're going to be closed for a period of time, they wouldn't necessarily need that PPE at the moment, and they're being requested, anyone who is in that position who has PPE that they might be able to donate, please do so.
We have one last question. According to Unity Point, the patient is at home and in isolation. Can you confirm what he has stated?
Well, again, this is not our case, so we don't have any info about it.
This is a question for the hospital systems who aren't here today, but I don't know if there's anything we can add. Are elective surgeries being rescheduled?
I get a daily update from the hospitals. The one I got from both systems today said business as usual.
Nita, anything to add to that?
Well, we have the same hospital system, so yeah, business as usual.
Great. We'll take this one last question. Is there a directive to dental offices to close?
I don't know if that's the case. I did get an email from my dental provider saying they were closing for a period of 3 weeks. That's my direct information.
Thank you all for taking time to be on the call with us today. Again, we appreciate your support in providing this great information out to our public. We're wanting to make sure everyone has what they need to keep themselves healthy and also to help us prevent the additional spread of the virus in the community. Please look for additional information to come from us, but we appreciate your assistance with getting the message out. Thank you. Have a good day.
Thank you.